Hi guys, and welcome back to the channel. Today we're going to discuss Primo and if you can do a Primo only cycle or use Primo as TRT. And by Primo I mean Primobolan. So I'm Dr. Downey and we'll get into this. So why is this such a popular topic? It's usually popular by those who don't know much about steroids and have heard that in the golden era they all used Primobolan and that's why they had a few side effects, and that Primo is one of the mildest steroids, and this isn't entirely true because firstly, although they did use Primo, quite often they also paired it with dianabol and testosterone quite often. So Primobolan is a DHT derivative, so that would mean that, so obviously it's not a testosterone derivative, so it doesn't convert to estrogen, so you don't get those estrogenic side effects. But there's a problem in that also, which we'll get onto just now. And, well, I'll just quickly explain. So you can't use something for TRT if it doesn't convert to estrogen, because then you're not really replacing your hormones. You'll be low in estrogen, and having too little estrogen is a problem in itself. So it's well known that methenolone, which is Primobolan, is actually equal in anabolic activity to that of testosterone, but it's androgenicity, so things like oily skin, facial hair growth, and stuff are mild, which is why it's like to be used in women. There are reports on forums that it does act as an anti-estrogen, but there are just reports. I've not found that in the literature, and so I cannot say definitively if it's true. So far, it would show that that isn't the case. It has been used in breast cancer, so maybe that's where it was thought that it's an anti-estrogen, but the reason it was used in breast cancer is because it was actually used in advanced breast cancer where there was metastasis or spread to different organs in the body, and especially the bone marrow, resulting in almost like an aplastic anemia where they're not having any production of blood cells and things. So Primobolan was administered at a high dose to counteract these negative effects in advanced breast cancer. Because it does stimulate erythropoiesis, which is blood formation, and that helped with survivability of these patients with advanced cancer. Didn't cure the cancer, obviously, but it did help in terms of just not being as sick. There is oral Primobolan, which is Primobolan Acetate, so it's quick acting and you take it daily. It's not hepatotoxic, meaning it's not toxic to the liver, so ideally you could take Primo orally by itself, but again, there are problems with that. And the issue with oral Primobolan, as you'll see here from this paper that was done by Kyoto University in Japan, that the administration, so essentially they said that 20 milligrams daily of oral Primobolan versus 100 milligrams of depot or intramuscular Primo every 10 days. So the oral use was much less effective than the intramuscular use. And again, I just wanted to emphasize the point that it's not a weak steroid. In the study that looked at the levator ani, which is this muscle in the pelvic floor, they used that in rats to see how anabolic and how anabolic steroids are, and they look at the thickness, and of course they found that the results were very similar to that of testosterone and nandrolone or DECA. So again, it's not a weak steroid, it just has fewer androgenic side effects and estrogenic side effects, which are good and bad things. So again, there's no evidence for this, but let's talk about it possibly being used as for TRT, although it's not TRT, it's just modified TRT, where you would just use Primo. The reasons why this wouldn't work is because it doesn't convert to estrogen, so you wouldn't have the benefits of estrogen. Obviously, there are benefits from it being within range. If it goes too high, you develop things like water retention, high blood pressure, gynecomastia. If it's too low, you get sexual dysfunction, poor cardio protection, and poor neuroprotection, so you feel brain foggy. So essentially, if it's used by itself, that would not work. That would not work well. But perhaps you could use Primo by itself paired with estrogen. Again, you're still not getting DHT, and whilst you don't need DHT, whilst you don't technically need DHT to function, there are benefits to DHT besides the negatives that people tend to state, like the beard growth and things like that, which it just makes you feel more androgenic. Especially, it's important if you're a male and you'd like to feel masculine. Also, DHT tends to support good mental health, whilst every hormone has good and bad things about it. Again, there's another type of modified HRT where people lower their dose of testosterone. Let's say they're on 200 milligrams of testosterone a week, and they're getting too many estrogenic side effects, and they want to not have to use an anti-estrogen, since Primobolan doesn't convert to estrogen, but it does give you those anabolic effects. Then you would do 100 testosterone, 100 Primobolan. It's usually used at a ratio of 1:1. That changes if you're blasting Primo, but we're not discussing that. So at a ratio of 1:1, you'd still get the benefit of testosterone converting to estrogen, and then the additive Primo puts you in that 200 range that you wanted to be in, so you are anabolic. Now, the only benefit I can see from this is still being able to maintain more size with fewer estrogenic side effects. Now, I'm not going to say that the Primobolan will block the estrogen that is produced by the 100 milligrams of testosterone, but it does attenuate the estrogen you would have got from 200 milligrams of testosterone, because now half of it is coming from Primo that doesn't give you estrogen. So that's possibly a way of abating these estrogenic sides. So it's a possibility as a modified TRT. However, it hasn't been done in practice, and obviously I wouldn't advise it because there aren't many studies on it, so rather stick to what is known. And again, the main reason people want to know if they could use Primobolan only is because of this whole golden era nonsense that's kind of spread on the internet about Primo being the drug of choice, whereas it's more or less similar to testosterone in terms of anabolic activity. So yeah. But yeah, so I hope you enjoyed the video. Again, Primo only would not be an ideal cycle, nor would it be an ideal replacement of TRT. However, there are modifications you can make which could possibly work. However, I would stick to what the science says and what is known. And yeah, I hope you enjoyed this video, and I'll see you in the next one. Follow me on Instagram, send me a DM if you need any assistance, and I'll gladly help you. So yeah, I hope you enjoyed, and I'll see you in the next one. Bye.